So number one is what the heck is going on? So we have to understand that physicians today are getting burnt out. And when people talk about being burnt out, we have to understand that these physicians in the primary care setting are seeing 25 to 30 patients in a day. They're running around. They're spending 10 to 15 minutes seeing patients. And then they have to do their documentation and their notes, which takes an extra 15, 20 minutes sometimes. There's refill requests. There's emails, and then there's portals now, and there's messaging on portal, and then there's hospital rounds. And if you're a hospital medicine physician or you're a specialist, you've got procedures, and then you've got hospital rounds to coordinate through. And then if you're employed, you've got committee meetings, and then you've got, all the other meetings that happen within that typical day. And so every physician who is employed is really running around trying to get everything done as efficiently and as quickly as they can so that they could come home. And when you finally do come home, you're exhausted. Or sometimes you just spend a lot of hours spinning your wheels. And so this is what makes a lot of folks burn out physically. But there's also an emotional component to it, is because our healthcare system is so controlled by insurance companies. That's really the true customer in healthcare. They decide what procedures, what hospital stays, what is covered, and what is being paid for. So a physician can say, hey, I recommend this treatment, I recommend this drug, I recommend this. Kind of doesn't matter because it depends on what your insurance company wants. So we could send appeals, and I've argued with a lot of medical directors for these insurance companies, and they will be blatant and say, well, I'm going to deny you now, but you can appeal. And I'll say, well, you and I both know that 99% of the time you're going to deny it. And they say, yep, we will, but you can definitely try. I mean, the audacity, they're just getting bolder. And that emotion, that is what really burns you out as a physician, is you just feel like you're trying to do the best you can for your patients, but you've got all these forces pushing on you so that you can make a good medical decision and a good treatment plan for your patients. And so, you always just wish, gosh, I wish it was just easy, where I have a diagnosis, I have a treatment plan, I have a easy, cost-efficient way to deliver this treatment plan to this patient, and everyone's happy. I wish it was that simple, but it's not. It's chaotic, it's hectic, and that's the current state of what our physicians are going through. And that's why it's not surprising that people are leaving medicine. They're literally selling books or something, or they're knitting, and they are selling fabrics or something. Like, they're totally leaving healthcare in all of its capacity. But now what's going to lead us to the second topic, which I really want to talk about also, is a physician has to understand their value and how unique they are. It's a simple economics of supply and demand. Do you know how many physicians there are in the United States? There's over 300 plus million people in the United States. What percentage are physicians? It's less than 1%. You have about 1.1 million, according to the Labor and Statistics. This is back in 2020, so it's pretty old data. But the more numbers I've seen also is 0.8% of the population, still less than 1% of the population are physicians. Of that less than 1%, 65% are specialists, and only 15% are primary care doctors, like family medicine doctors, internal medicine doctors. 15%. So I am less than 1%, and I am 15% of those physicians as an internal medicine board certified physician and a hospital medicine specialist. So that is crazy. And so as a physician, you have to understand that you're working your butt off to become a physician. You're in your top percentage of your classes. You've worked hard to get to where you are. And now you are in high demand and low supply. That should really change your mind about how you get treated, what jobs you take up. And more importantly, you really should be an entrepreneur. You really should say, hey, I'm going to go into this career, and I'm going to actually think about all the ways I can leverage my knowledge and my skills, because there aren't a lot of physicians running around and that are available. So whether it's research, medications, drugs, pharmaceuticals, medical devices, to teaching, professorship, authorship, to social media, doing videos, educating the public, to creating a practice or a company that allows you to practice the way you want to practice, because you could do that. Whether you have an insurance model, a hybrid model, a direct primary care model, however you want to do it, you could do it. And the fact of the matter is, a lot of us graduate from medical school in our training and residency, especially primary care physicians. You're still pretty young, 28, 29 years old, 30-year-old. You're so young that you can absorb some risk, take some risks. I mean, why not? What do you have to lose? You'll always have a job. Those shifts aren't going anywhere. How many of you actually get recruiter texts and emails and phone calls? Exactly. Many, many times. Almost every, 2-3 hours, you get a text from a recruiter. Hey, I have a need in Missouri. I have a need in Alaska or Hawaii or Florida, wherever. So you're always going to have a job. You're never going to be unemployed. So why not take a risk? Take a challenge, build a company, do something where not only can you satisfy the way you want to practice, but you can employ people, give them an opportunity for them to excel in their professions and support their families. You'll start to realize that it's not about you when you create a company, it's really about them. So it's pretty rewarding. And I would argue that will avoid you from being burnt out. Finally, number 3 is my story. So both of my parents were immigrants to this country, and they both worked hard. I mean, if you imagine in those days, they come to a new country, United States of America. United States was like the gold mine. I mean, that's the place everybody wanted to go to. It was the place of opportunity. Everybody would literally scramble to get to the United States back in those days. And so my mom was a family medicine physician. She's retired now. My dad is an entrepreneur, actually came for an engineering degree at the University of Texas in El Paso, and then decided I can make more money in business, and started to do real estate. And so I drove around watching him do deals. We had apartment buildings in this one neighborhood in Chicago, around the corner. So we had a couple of buildings, and he would share this story with a lot of people. He would set up a lawn chair and he would sit at the corner. Be like, what are you doing? I just want to go play Nintendo. Can we go home, man? But what he was doing was actually building relationships with people. Everybody knew him. Oh, there's Nasser. Oh, so-and-so. He knew everybody. There was a bar right across the street. There were some shops. There was a gas station. And so he would mingle. He knew everything. There was a pizza place down, there was a hot dog place at one time. And so he just kind of knew all the small businesses. He would mingle. Everybody knew him. He was building relationships. He was community building. And so I watched that. And then I started to appreciate that. He also was a business owner where he would mop the floors. He would do whatever it took. He always talked about the appearance of the laundromat, for example. That was one of his many businesses. But the appearance of the laundromat, the floor had to be shining. The machines had to be clean. I mean, he thought about all the meticulous details. The gumball machines could not have any crud in there, and so that the coins don't get stuck. None of the boxes that we had, for the bubble gum or the toys or whatever had to be hidden away in the laundromat so people didn't see a mess. Everything had to be clean. The counters had to be clean. And so he was so particular. The music had to be the right volume so that people aren't irritated by the sound. We had video games in there. We wanted to make sure people weren't just loitering and hovering around so that people didn't feel scared to do their laundry there. So he thought about all these things. I took note. My mom, private practice, back in the day, I did medical billing on a typewriter for her with the carbon paper in between. You know what I'm talking about. And then you would separate the 2 sheets and then mail it out. Well, I did that. I did front desk, and I would watch people take buses and trains to see her. I mean, how cool is that? I also experienced when I would type for medical billing, we would get denials because we forgot on the address the spaces or a period or something ridiculous. And they would send it back and they'd deny the claim. Like nothing medical, nothing. It was just the way, or the words not fit in the boxes, as we typed it on the typewriter. There was some leakage. The letters would fall below the line or something. It was stupid. But anything to deny a claim. So she would resubmit, she would white it out, retype, put it in an envelope, mail it out. Right now it's all electronic billing and all these things. But So I watched that. I paid attention to that. In private practice, she would go to the hospital. She had the clinics, but she would spend a lot of time with her patients. And so that really rang with me. And I sat in a lot of doctors' lounges, even on the nursing floors. Everybody loved her. I saw how she communicated with the nurses. I saw how she treated her patients and the family members. She really focused on the family members. Her writing was not legible at all. So I learned that when I become a physician, my writing has to be legible. These are the things that I picked up. And so when I went into college and I started to get my master's in health administration, and got my business degree, my college degree actually, in health administration and interpersonal communication. So those of you who think pre-med people have to get bio and chem, no, you can major in anything. I would advise you major in something other than sciences. So I did health administration and interpersonal communication, got better at communication piece, presentations, talking to people, those kinds of skills. I learned so much, actually. And then I got my master's in health administration in medical school. And then so I was building. My philosophy changed. I followed Jim Rohn. I recommend that you do as well. My life philosophy started to change. I started to invest in myself. As I went through residency, I started to keep my eyes open. And I remember I actually applied to become a chief resident, and the medical or the program director, she said, Haseeb, you actually don't want to be a chief resident. You really need to be the president of our resident council. This is the first time we're going to have this resident council, and I want you to be the president of that. It's a new organization. You're going to be sitting with the MEDISECs, and you're going to represent all the residents in the program. And I said, oh, that's pretty cool. I'll definitely do that, rather than just be a chief resident looking at the internal medicine program. I'd rather open myself up to all the residents, and all the programs, surgical, non-surgical, etc. So that was a valuable experience. And I was so nervous in those meetings. I mean, here's a young kid. I'm like, I don't know what's going on. But we started to talk about topics and resident experience, patient experience, communication, handoffs. These are kind of things that we would talk about. Then I started to connect the dots. And as I became employed after I graduated from residency, I was hungry to learn. I knew I had to put myself in positions to challenge myself as a leader, but also to learn and network. So for 3 years, I worked as an employee, or 5 years, I worked as an employed physician. But the first 3 years, it took me that long to say, you know what, I'm not satisfied because I feel like I'm just in a factory. I can treat a COPD patient, but I can guarantee in 2 to 3 months, they're going to be back because they can't afford their inhaler, or they can't see their primary care doctor for a couple of months. They can't see a specialist. So to me, access became the bigger issue than cost and, the things that we are talking about. So cost and access are bigger issues than coverage. We talk about medical insurance coverage. It's a good political talking point. The reality is, even though you have a plastic card, access and cost are bigger issues. So it took me 2 years to develop a business plan and then to get the guts to actually do it. So 5 years total of employed work. And then I did a lot of Excels, a lot of analysis paralysis. You guys know what I'm talking about. There's people like that out there watching this. But I finally made the move. And I'll tell you, all the networks and the support and the friends I made at the hospital while I was employed, to this day, actually our company partners with the health system. The physicians that have helped me, now I have the ability to give back, because now we have a strong partnership between Live Active Health and the health system. And we coordinated, we solved so many issues in the post-acute care setting, in primary care as well, where we work together now. Like, how cool is that? Life is full circle. So, dream big, invest in yourself. As physicians, you're less than 1% of the US population. We have a lot of work to do. You're not burning out because of practice of medicine. You're burning out because the system has a lot of pressure on you. Figure out how you can work within that system, or do direct primary care, or figure out a way to be, a cowboy and say, you know what, I'm really good as a physician, and I'm going to bet if I have this certain practice, my patients will follow. Let quality be the leading front, because revenue will always follow your service. So focus on service, and the revenue will follow. And most importantly, you're going to have a career that's long. It's a marathon. It's not a sprint. So enjoy the journey. We're in this life for a limited time. Enjoy the journey. Enjoy the friends that you make. Enjoy the patients are the best. I mean, the hugs, the smiles, the hands you get to hold. How cool is that? It's the greatest thing ever. So if you're thinking about being a physician or you're a current physician who's frustrated, I hope I've given you something to think about. Hope I planted a seed. You know, that's what we do in business. We just plant seeds, we network, we talk, we let things kind of cook a little bit. I'm all about that. No rush. Take your time. So please subscribe to our channel, write any comments. I'll keep doing this. There's a lot of talented physicians out there. We got to help each other out. Don't give up yet. You're very valuable. So keep brainstorming, keep trying, innovate. The sky's the limit. Thanks for watching.